So I'll tell you what, we appear to be having some technical difficulties getting Senator Husted on the line. Whoops, do we have him? Here we go. Let me see here. Get the hang on just a second, hit a couple of buttons here, and there we go. Senator, are you there?
I am.
All right, there we go. Now we've got it again. Is the is the fun of live radio. Good to have you on the line with us this morning. As we mentioned a little bit earlier, this is your first government shutdown since arriving in Washington, D.C. What do you think so far?
Well, it is. I don't think much differently than when I was not in the federal government. These things are kind of silly and unnecessary. There are ways that, it's okay in life to want to leverage situations for political outcomes, but you shouldn't shut down the government to do it. And that's why I think the Schumer shutdown is wrong. I believe that Chuck Schumer should do exactly what he did 13 other times, including the entire Biden administration. Vote for a clean CR, meaning keep government funded at the current levels, and anything that you want to negotiate, we can keep negotiating. By the way, there'll be another deadline 6 weeks from now, because all this says is keep government funded for 6 weeks. We'll keep talking. Don't shut things down. Keep serving the public. But it's an unnecessary disruption.
But when you say keeping government funded at its current levels, that doesn't include the subsidies that Democrats say are critical for the millions of Americans who get their health insurance through the ACA exchange, who are going to get notices this month. They say that the time is of the essence here. There's no, this can't wait 6 weeks because those notifications are going out this month.
They're wrong. That these don't expire until the end of the year. Just because a notification's going out does not mean that anything changes. And by the way, I have said, many people on the Republican side have said, we're willing to have those discussions, but not, by taking the American people and the government hostage. We understand what we're talking about here. These were supposed to be pandemic era enhancements, not the original Obamacare, enhancements that came during the pandemic. They were never funded. There has been billions of dollars of documented fraud that's gone on under what they're talking about. Those issues have to be resolved. We can't keep paying for millions of phantom customers that occurred under the Biden administration's program. And we just saying, look, let's go have those conversations, but you can't shut the government down. That's irresponsible.
Is there, here's the other argument. Again, we went through this a few weeks ago, a couple of months ago, when Chuck Schumer did actually vote for the continuing resolution, and it doesn't appear that there's been any progress made. Why should we believe that there would be any progress made in the next, setting aside the Obamacare subsidies, just in terms of getting these bills passed that would that would set up a budget for the next year? How is 6 more weeks going to solve that?
Well, first of all, 3 Democrats have already voted with us on this. We only need 5 more.
Right.
They know that this is wrong. That they're using tactics that they reviled Republicans over by saying, "Hey, you can't shut the government down. You got to keep things going and negotiate." That's the way the process is supposed to go. It's not going to change. You have to pass budgets with bipartisan support. Right now, there's not bipartisan support for what he wanted to do, because I want to also tell you the other things that they were in their bill. To continue to pay for health care for illegal immigrants. That happened under the Biden-era pandemic emergency program.
Let me stop you there. Let me stop you there because...
No. You'll let me finish on this one. Let me finish on this.
All right.
That's in their bill. That's what has been happening, and we're not going to be for that. They also want to continue to allow able-bodied, healthy adults to get free Medicaid without working. That's also wrong. We will not do those things which are part of their conversation. What I am interested in doing is happy to talk about how working people, how we help reduce the cost for working people. And that we will discuss. But these are non-starters, which are in their continuing resolution, which will allow continued payments for illegal immigrant health care and continue their Medicaid fraud that they had been perpetuating for the last during the Biden administration.
With respect to the issue of health care for illegal immigrants, let's delineate here. And as Democrats have pointed out, and this is the case, it is already illegal against the law for those who are in the country illegally to get health care system and benefits through the system. It appears that what Republicans are talking about here are those who are in the country on temporary work visas and things of that nature. Technically, those would not be illegals.
So that's not who we're talking about.
But doesn't the law already, wait a minute, doesn't the law already say, and I know the answer, it does, that illegal immigrants don't qualify for this. So isn't that an enforcement issue?
Just yes, but they built loopholes around that. That's what I've been trying to explain for this interview with you right now, is that they built loopholes around it because what they put in there under the Biden administration were emergency services, pandemic emergency services. And what happens in states like California is that they have sanctuary cities where they bring a bunch in sanctuary states where they allow illegal immigrants to come to their states. They don't enforce the law. And here's what happens. Eventually they get sick, right? If you have 1 million people in your state who are here illegally, eventually they get sick. They go to the hospitals. They get care, all right? And then the states are drawing down money from the federal government for, quote, emergency services, and then they use those Medicaid dollars that they draw down to pay the hospitals for care. So the illegal immigrant doesn't get a check directly, but what they do is they go to the hospital, they get the services, they draw down Medicaid dollars, and then they reimburse the hospitals for paying for health care for illegal immigrants. That is happening. I can document all of it.
Fair enough. Fair enough. But at the end of the day, with respect to the premium subsidies for Americans who are finding their health care or moving to the exchange because that's the only affordable option that they have, they're going to get notices this month saying that once these credits expire, their premiums are going to go up 40, 50, 60% from
that's not what they will in Ohio.
Well,
depending on what I've seen the numbers in Ohio, it says anywhere from 4% to 31% that their premiums could go up. But understand, this was
31% is still pretty
pandemic era related program that never existed before. That now they want to continue. I am happy to have that discussion for working people. But they need to give up their demands on these other issues and go along with us on those things. And by the way, you can't get down the cost of health care by continuing to have the government subsidize a broken system.
Well, I think everybody would agree with that.
We need to have reforms. We need to stop the phantom people that they're enrolling under this program. Because remember, what happens is these are premium subsidies that go directly to the health insurance company, not to the person, but to the health insurance company.
Right.
Those health insurance companies are enrolling many, many people. There was a case in Florida where they had enrolled over a broker had received over $1 million, $100 million to the hospital system and the insurance company for phantom enrollees, because all you need is their name, address, and things like that.
Right.
Those things have to be taken care of.
I've got to stop you there.
Before we go ahead and look at this. So when they're willing to have those conversations, I'm willing to have them, but we need to reopen the government, serve the people who have nothing to do with this while we're putting that together.
Agreed. And we will leave it there. I have to stop you because I am absolutely out of time. But I would look forward to that conversation with respect to fixing healthcare, because I think you are absolutely right when you say that this is a broken system that needs fixed. And it's more than just premium subsidies that are the problem. So hopefully we can...
Great. I look forward to it, and thanks for a great conversation.
Have a conversation on that. Senator, thanks very much for taking the time.